I knew I could not cope with this on my own. You know, that was my first thought when they said to me, you had cancer. It was, you know, this can't possibly be true. And damn it, it was.
I was really traumatized and scared. And on one hand, you know, they started to talk about taking my bowel out and putting it on my stomach. And, you know, you think of a sex life, you think of your body image, you think of absolutely everything.
It's just something really important, I think, about touch and about being touched in a way that isn't that medical way. You already feel a bit of a pariah because you've got this sort of terrible disease which, you know, you tell people about and all they think of is death. And I spent, you know, an entire year of just stress and anxiety and fear, and it sort of consumes your mind all the time. The little bits of time I had with Keith were just sort of enough to bring me out of my head and back into my body.
Keith's had a major input on the hospital with his work. He's the only one, really, as far as I'm aware, in the country who set up a massage unit and a complementary practice unit in a major teaching hospital.
15 years ago, it was hostility. Was actually, oh no, don't do your massage stuff on our patients, please. And it was only through the one doctor who then got a better rapport with her patients.
It was that positive point in my day. It was the part that I looked most forward to. And I really felt that it got me through times that I thought I was going to lose my mind. All the premises in your life about remaining strong and not thinking about pain, and all those things are challenged in this environment. Everything you think you know is turned upside down. Having the massage just gave me a little bit of calmness in between this turmoil that I was going through in my head all the time.
The patient isn't the disease, and the patient is the person, and we treat the person, we don't treat the disease. I'm not a doctor, I can't help in that line, but we can actually look after that person.
A younger doctor just said to me yesterday, you know, I think this is the most wonderful service. And the nurses, they enjoy it. And you'd be surprised how 3 minutes leaves them enervated and relaxed. And then a couple of others will say, I want one too. And you get a really nice atmosphere.
A day's stay in an NHS hospital, I believe, is about £850. So if you can reduce that stay by 2 days, you're talking £1,700, which is a lot of money.
There's no doubt that using things like massage therapy would save the hospital money, because there's a lot of medication given for musculoskeletal illnesses, for pain, for stress, and it would save on the drug budget. That's the first thing. Secondly, nurses, for example, staying off work from lifting and stuff, who could be prevented from staying off work by dealing with their stress using massage therapy.
One young lady was having a stoma, which is a colostomy bag, cleaned and changed because she had a wound as well, 3 times in theatre. The estimated charges were £10,000. We did a massage every time her dressing was changed instead of having theatre visit. You know, that's the biggest saving we've had on any one patient. I think the reason it works at the Royal Free and is it's totally accepted is that I've made it quite clear in all my talks that we only complement traditional medicine. So that's the easiest way to explain to a doctor. No, they can't have me and not you. The doctors in the end went with it because they saw no adverse effects that they were still in charge and could tell you exactly what treatments were allowed, which I think if they are basically the responsible person, then that's fair enough.
I think that I wouldn't really believe that it could do as much as it does for people if I didn't see it happening every day. And every day that you work here, you are reminded again and again of how important it is for those people. And I've had comments from patients to say, "Oh, I feel my legs belong to me again."
The only thing you do when you work against the system is antagonise. And antagonised doctors will never give you work. You know, you're just a pipsqueak that's shouting too much. So I know the system, and I know the system can't be. It can be bucked, but then for what gain? Because then patients will be excluded.
There's no difference between the Royal Free from any other hospital. I can't understand why it hasn't been set up in other hospitals. Well, I can understand, because of the short-sighted management, basically.
So you have to be very professional, and that will keep this going. And the public will then demand. And I think that's noticeable. We've had people come to have chemo here as opposed to somewhere else because they can access us. So I do think patients are voting with their feet in some ways. But it does need Joe Public out there to say, that's what I want in my care package. I want some nice TLC beds. And it can be done. We've proved it.
I'm a great believer in humour as well in medicine, and part of the effect that Keith has on patients is he cheers them up and tells them jokes. Some of them are a bit blue, but I don't mind that.